Gail Nyowitz, and myself. Great, thank you. I want to start by asking if there are any corrections to the minutes from our June 5th meeting. Okay, hearing no corrections, let the record reflect that we are going to adopt the minutes from the June 5th meeting. I'll take a vote from each member. Dr. Galvez? Approve. Dr. Katz?
Yes.
Dr. Kwan? Approve. Dr. Lindsay?
Approve.
Gail Nyowitz? And I also approve. With unanimous vote, we're adopting the minutes from the June 5th meeting. Moving forward, it looks like I'm missing a page. Thank you. So our next item on the agenda is the adoption of emergency rules for amending Article 47 of the New York City Health Code and approval for the publication of proposed amendments to Article 47 of the New York City Health Code. Our presenters are Corinne Schiff, Deputy Commissioner of Environmental Health, and Renee Knoll, Assistant Commissioner of the Bureau of Child Care. I'll pass it to you for your presentation.
Thank you, Commissioner. Good morning, members of the board. I'm Corinne Schiff, Deputy Commissioner for Environmental Health here at the City Health Department, and I'm here with Renee Noel, who is our Assistant Commissioner for our Bureau of Child Care. And as you heard from our Commissioner, we're here to present proposed amendments to Article 47 of the Health Code. Next slide, please. And for some background, the Health Code Article 47 sets requirements for child care centers in New York City. These are programs serving children under age 6 in freestanding commercial spaces, and we have about 2,200 of them in New York City. Article 47 sets requirements for a range of health and safety protections, and including, as relevant for us today, qualifications for staff and ratio of children to staff in the classroom. You may know that New York City, like localities across the country, faces shortages of childcare professionals. And as a result, we see that childcare providers may reduce enrollment, suspend operation, or sometimes delay opening. And so parents or guardians may be unable to find regulated childcare. So our proposals today are to add flexibility for childcare providers without compromising safety. Next slide, please. First, we are proposing to add flexibility for the education director. The education director is the program leader. They are responsible for the curriculum, the overall program direction, staff supervision. Our current rule in the health code is that the education director must be on site whenever there is at least one child present. Problem with that is that many programs are open longer than a typical workday, and indeed parents need programs to be open these longer hours. They need them to open early or close late to accommodate their own work or school schedules. But an education director can't realistically or even appropriately work a 10-hour or sometimes longer day. So our proposal is that the education director instead must be on site during what we're calling core hours. And this would be the period when the program engages in activities, experiences, and routines that promote physical, intellectual, and emotional learning for children during the hours of service. And that would be at least 8 hours. Next slide. Next, we want to add some flexibility for the coverage for the education director. We already in the health code have a provision for coverage for the education director, but it's limited to a group teacher who has New York State certification. We're proposing to allow that a group teacher who isn't certified but has significant childcare program experience can also cover for the education director. We want to ensure that there is constant coverage for the education director. Now that we are discussing 4 hours at 8 hours, we want to make sure that the rest of the time that the program is open, it is clear who is in charge. The current rule doesn't require the program to name in advance who will cover for the education director, and that can lead to some gaps in communication. So we're proposing that the program list the education director designee in their safety plan, which is already a required document, so that all of the staff and the department know who is the on-site supervisor. And then next, we want to make sure that there's a clear time frame for coverage. The education director designee is not the education director. They don't have the same exact qualifications, and the current rule doesn't specify a time frame. So we're proposing to specify that and to limit it to up to 60 days. This gives the childcare operator time to find a new education director if there is a permanent separation, and also provides some flexibility for shorter term absences when the education director is on vacation, personal leave, other kinds of short-term absences. Next slide. Okay, now we want to turn to group teachers. Want to add flexibility for group teachers. Group teachers are the leaders in the classroom. And the health code sets group teacher qualifications, and those depend on the age of the child. And our threshold right now is under 24 months and 24 months and older. We're proposing to align this with the qualifications for traditional preschool designation, which is 3-year-old. So we would make these qualifications under 36 months and 36 months and older. And this is going to expand the hiring pool for preschool, better enabling providers to serve their younger children. Next slide. Next, we want to add flexibility to meet ratios when the group teacher is absent. So Article 47 requires that every classroom have a group teacher and also maintain a ratio of staff to children. And exactly what that ratio is depends on the age of the child. The code allows that when the group teacher is on break, could be for lunch, or is absent, a teaching assistant and teacher's aide can be in the classroom to ensure the staff to child ratio, but we are currently limiting that to 3 days. And we would like to expand that to 5 days as a strategy to improve employee retention. Next slide. And now we want to talk a little bit about the process, which the commissioner touched on. We are proposing that these changes be implemented immediately. So if the board approves the changes today, the mayor would authorize these amendments to go into effect immediately. And the urgent need for this is that New York City Public Schools is hiring 3,700 additional teachers by September in order to meet the New York State class size mandate. And so there's a concern that the New York City Public School hiring may draw childcare professionals from those programs into the public school. So to preserve current childcare staffing and promote availability of future qualified candidates, the programs would be able to implement these changes immediately. We would then open this proposal up for public comment, as we always do. And we would then come back to the board following that comment period and the public hearing for a proposal for final adoption. Next slide. There are going to be 2 rounds of discussion and voting here. So first, we are asking the board to vote to approve the emergency amendments to Health Code Article 47, and we're happy to take questions.
Great. Thank you, Corinne. Questions for board members? Gail, please.
I actually more have a comment. I've worked with Corinne for a very long time on these issues, and it's really incredibly heartening to see the changes proposed. I think it's going to be terrific for the field, great for families. So commendation to you both. Renee, I don't know you, but congratulations. But also, would there be a way for us to know for the next meeting or whenever we have to vote again and it goes to the public for comments, could we hear from you all about how the sector's responding and whether or not the staffing changes that you are trying to protect against when the poaching from the DOE happens or doesn't happen? We'd love to maybe hear how successful this was as a strategy. It would be great to know that. But just in general, super long overdue, super happy, and terrific proposal. Just my view. I shouldn't say that ahead of voting, but I just want to clarify.
Thank you. And we would be happy when we come back to the board to share what we're hearing from the provider community.
Yes. Dr. Lindsay?
Yes. So on the part about moving away from certification and acknowledging those who have significant childcare experience, what does significant childcare experience mean? Is there some kind of
Yes.
quantifier?
So let me start, and I'll hand to Renee for the details of this. But the health code also has provisions for how a group teacher can qualify. And there are multiple levels of that. Right now, the group teacher only at this highest level with the certification can cover for the education director. we're expanding that to allow the group teacher who meets these other qualifications also to serve. Do you want to talk about how you do qualifications?
Right, right. So we basically are covering the qualifications of teachers based on New York State education. And we believe that it promotes adequate child education at that early age. And so the D1 currently is in the code that we allow a person that's already certified to cover as the ed director. But we now are allowing D2, which is a person that has experience. They have a bachelor's degree in early childhood education as well as related field. And we have a list of the related fields which we've promoted and we have on our website so people are aware of it. And also 2 years of experience. We really believe that it's the experience that they have, the nuances that they learn in practicum that allows them to be able to share that and promote, quality education in the classroom and continuity of care, to have the same group teacher along the way. And so we're trying to prevent like the attrition rate, and going to DOE and all of that. So basically, without compromising, education and safety.
Thank you.
Can you guys speak to the study plan issue? So we can hear how the progression goes and how a teacher can become
Yes.
certified teacher.
Yes, thank you. So the D1 and the D2 that Assistant Commissioner Noel referred to are the code, the provisions of this section of the code.
Right.
What Ms. Nawith is referring to is another way that you can qualify to be a group teacher, which is being on study plan. So that is when you are still in your educational program to get your early childhood education background, educational background. That we are not extending. We're not adding that as someone who can cover for the education director because that person is still in the process of learning the field. So we're taking one step, which is to say, if you've gotten your degree and you've got that 2 years of experience, then you can cover outside of core hours and for that up to 60 days. But we're not, there are other ways to be a group teacher that we're saying, you're not ready to run the program, even in this limited time, you're focused on getting your education to be able to be a group teacher in the classroom. Does that answer?
Dr. Kwan? Yeah.
I really appreciate that you thought through how to protocolize the designee for the program leader and that it's going to be included in the safety plan. But how often is the safety plan updated? Is there opportunities for them to do that?
Yes, yes. So whenever there is a change, they need to update that safety plan.
There's no, it's not updated annually or,
Yeah, the code requires that it be updated annually.
but then any.
When there's a change.
Yeah, and when there's a change.
No.
We will be, should the board approve, we will be notifying the programs, including of the requirement to add this to the safety plan. And we will share a template with them to ease their addition to the safety plan to name these people. But we do think it's so important that it be very clear who is in charge at all times.
Mhm.
Okay, any other questions from board members? Okay, so we'll now vote on adopting the emergency amendments to the Health Code, Article 47. Could I have a motion to approve the notice of adoption of emergency rules for amending Article 47 of the New York City Health Code?
Motion to approve.
Thank you, Dr. Galvez, for the motion. Could I have a second?
Second.
Second from Ms. Nywood. Thank you. And I'm going to take a vote from each member. Dr. Katz?
Yes.
Dr. Kwan?
Approve.
Dr. Lindsay?
Yes.
And myself, Dr. Morse, approve with the unanimous vote of 6 out of 6 in favor of the motion. The motion carries. Thank you, board members, and thank you for the presentation. We have one more vote that we can move to the next slide.
Slide, please. Yep. And now we are asking the board to approve these amendments for publication in the city record so that we can open our comment period. Happy to take more questions or to move to the vote.
Motion to approve.
Great. Thank you, Dr. Kwan, for the motion to approve. Could I have a second?
Second.
Thank you, Dr. Lindsay, for the second. I'll now take a vote from each member. Dr. Galvez. Approved. Dr. Katz.
Yes.
And Ms. Naomi, sorry.
Approved.
And I also approve. So with a unanimous vote of 6 out of 6 in favor, the motion carries to and in the city. That's to Article 47. Thank you, Deputy Commissioner Schiff and Assistant Commissioner Noel. Thank you.
Thank you.
Yeah.
Okay. Our last item on the agenda for today is the proposed notice of adoption to amend Articles 3 and 11 of the New York City Health Code. Our presenter is Dr. Gretchen Y, Chief Epidemiologist and Deputy Director for the Center for Population Health and Data Science and Assistant Commissioner for the Bureau of Vital Signs. Over to you, Dr. Van Wy.
Thank you. Good morning. I'm here with you today to present adoption of amendments Article 3 and 11 to the New York City Health Code. This is what I presented for publication in June. Go to the next slide. So in summary, we proposed amendments to Section 3.25 and 1111 of the Health Code to bolster confidentiality and privacy of data held by the Health Department. Specific changes included aligning the definition of identifying information with the administrative code, specifying the commissioner or other authorized personnel at the department to determine disclosure for the purposes of treatment, prevention, or care, and to specify in Section 3.25 that only the minimum information necessary by the commissioner or the designee to accomplish an intended purpose is disclosed. Slide. So the Board of Health approved publication of these proposed rules on June 5th. The notice of intention was published in the New York City Record on June 20th. The public hearing was held on July 21st. No one testified at the public hearing and we received no written comments. So we made no changes to the rule that was proposed. And now go to the next slide. I'm here to ask the board to adopt proposed amendments to Articles 3 and 11 of the Health Code to bolster data confidentiality and privacy.
Thank you, Dr. Van Wy. Any questions from the board?
Question.
Yeah,
Along the lines of Dr. Lindsay's question to Corinne and Renee, how do you determine the designee? Or I don't know, Commissioner, do we ask you? I'm not sure.
Commissioner.
Somebody, yeah.
It depends a little bit on the specific type of data, but because of the expertise that we have, I think we've got quite a deep bench of expertise around privacy specifically. But Dr. Van Wy, if you want to add to that.
Yeah, I think that there's a lot of, it's what the commissioner said, there's a lot of deep knowledge within each of the bureaus around each of the different data sources. And so there's a collaborative consultative process with the general counsel's office, with our chief privacy officer, with our commissioner to make determinations.
Any other questions from board members? Okay. All right, so we'll now vote on adopting the health code amendments. Could I have a motion to approve the proposed notice of adoption for amendments to Articles 3 and 11?
So moved.
Thank you, Dr. Katz. Could I have a second, please? Thank you, Ms. Iwith. I'll take a vote from each member. Dr. Galvez.
Approved.
Dr. Kwan.
Approved.
Dr. Lindsay.
Approved.
And I also approve. So with a unanimous vote of 6 out of 6 in favor of the motion carries. Thank you.
Thank you.
Any remaining business from board members that you all would like to discuss today or propose? Okay, all right. Thank you everyone for your service. The meeting is now adjourned.
Well, I'll see you.
Like the half.
Yeah.
Yeah,
Can you let them
stop
know
by
that-
first.
Yeah.